MD Conference Live presents updates from the American College of Cardiology meeting in Orlando, Florida.
First, we found that the Polypill was very well tolerated. The study was a 12-week study, randomized, double-blind. The company were clever enough to make sure that the 9 pills in the 9 arms looked identical. And it's actually a capsule with a very clever formulation. And it showed that the side effect rate with 1 drug active, 2 drugs active, 3 drugs active, 4 drugs active, and 5 drugs active were identical. That was a surprise, a pleasant surprise. And the reason for that is the side effects of 1 drug tend to counteract the side effect of another drug. For instance, an ACE inhibitor increases potassium and increases creatinine. A thiazide does exactly the opposite. So, in fact, you get on hyperkalemia or in azotemia a lower rate when you combine it rather than when you give each one separately. So that was the first good news. The second good news was that 3 blood pressure lowering drugs reduced, compared to controls, systolic blood pressure by about 7.5 to 8 millimeters more, starting at normal blood pressures. So it does go down, but it doesn't go down as much as in hypertensive people. We estimated that the reduction in systolic blood pressure will lead to about a 1/4 reduction in heart attacks and a 1/3 reduction in strokes. Second, statins lowered lipids by about 25% in the Polypill and a little more, about 28% when simvastatin was given alone. These 2 numbers are significantly different, but clinically they're not different. When we put all the things together, we've estimated that the Polypill will likely reduce heart disease by about 60% and strokes by 50%. These numbers are substantially lower than the estimates made by Walden Law. Despite that, if we can halve cardiovascular disease by a single pill, if it's efficient and safe and tolerable, which it is, that is a huge step in the management of patients. So we believe this important step will lead to further development, further trials, but could actually make a big difference to the way we treat people.